At its core, understanding if a treatment or intervention is therapeutic is understanding if signs and symptoms are moving in a positive direction as expected. And that includes within the time frame that is anticipated. For example, I wouldn't expect a fracture to repair in 2 weeks. I would expect 6 to 8 weeks. All structures and orthopedic disorders have a prognosis that implies a certain amount of time for the disorder to reverse or heal. What I want to talk about today is kind of this hierarchy of understanding the demands and how it informed what we'd expect to change first versus later in the course of healing. Symptoms and signs are what we use to measure progress. Symptoms, for the most part, what the patient is experiencing or feeling, are relatively easy for patients to understand if they're getting better or worse or not changing. I do have to educate many patients on centralization as a phenomenon that exists with spinal disorders and referred or radicular symptoms, meaning if the symptoms are moving towards the spine and they're temporarily more intense, though that intensity is noted as a worsening by many patients, it's actually an improvement if it's centralizing to the spine and abolishing in the distal periphery. But outside of those cases, there's not much education that is needed. People know if their pain is less intense, less frequent. They know if that patch of paresthesia or tingling or numbness is getting smaller. They can appreciate if if symptoms are getting better or not. Signs, though, fall into the domain of the clinician more so. I need to know what signs are part and parcel of the disorder, and I need to know what signs I expect to change first. That's when I think about the hierarchy of demands on the musculoskeletal system. For example, walking very slowly is less of a demand than sprinting, and there's a hierarchy, there's a spectrum of demands on the system. Knees, hip joints, back joints, nerves, muscles, upper body, everything. There's a spectrum of how much we're asking the body to do anywhere between walking slowly and sprinting. So for me, I think some people may discount a therapy because they're judging whether or not it affects sprinting, when first they should be judging whether or not it affects walking slowly. So that is one example that I don't have many sprinters as patients, but a lot of people I see do want to be able to jog or run without pain. So for example, if someone has a knee derangement and it looks like knee extension is what they need to restore signs and symptoms to normal, if they have trouble, for example, doing a squat, one body weight squat, or doing one step up onto a 6-inch step, or walking in the hallway produces that knee pain, if we do knee extension, I'm going to test whether or not they affect those lesser demands first before I would expect it to change jogging or running. So even if I had a treadmill right here, I wouldn't say do 20 knee extensions and let's retest jogging. I would say let's do 20 knee extensions over the course of 2 minutes and then retest the bodyweight squat or the walking or the step up, something that's less of a demand. There are outliers where it's a pretty easy to resolve derangement, for example, and I would expect for those, or I would see with those people that within a day the jogging is normalized, but those aren't typical. It usually is a progress whereby the easier things get resolved first, and then we gradually challenge the disorder, the body, with harder things, and they prove to be healed as well. An example for the upper body might be someone who has weak triceps and my pressure is painful and weak, but also a push-up is painful and weak. Well, if we do a neck motion or thoracic motion, say it's a spine disorder, and it gets better here, it's not necessarily going to get better with the push-up because that's more of a demand. So I'm going to test this one, and I may test the push-up as well to get an idea of where we stand, but I wouldn't only test the push-up because, again, that's a harder demand. I don't expect it to change in 10, 20, 30, 40 reps. It might, but if I have another test that's less of a demand in that spectrum, I'm going to test that one first because I would expect that one to change first. So it doesn't apply just to joint derangements, it applies to tendinopathies, it applies to recovering from an orthopedic surgery, a lot of things. You need to walk before you can run, but I just don't want people testing something that's too aggressive and seeing no change and therefore discounting the treatment. With joint derangements, we can do 10, 20, or 30 repetitions in the office in a matter of minutes and see strength restore with manual muscle testing. We can see a body squat become painless. We can see a step up become 50% less painful. Joint derangements by nature are rapidly responsive if you move the joint in the correct direction repeatedly. And for many people, 10, 20, 30 reps is enough to see some change with the more benign challenges, the easier musculoskeletal things to do. Some people, like I said, I have them go run and they're pain-free after just 30, and those are the outliers. But if you only tested the running after you moved your knee into 30 extensions and you didn't test the step up, and say the running was just as bad, and you say, oh, well, knee extensions is not for me, it didn't change my running, you might be throwing it out too soon, prematurely. Because if you had tested the step up, you might have been like, oh, I did 30 knee extensions and now the step up is significantly better. That would be, in many cases, or in most cases, a reason to keep doing the knee extension. So yeah, don't discount things because you're testing the wrong thing. Signs vary in demands, and we're typically seeing things with less of a demand first. Of course, we could also go by non-functional signs like, am I seeing range of motion change? Am I seeing just pure strength change? Am I seeing nerve extensibility change? Those are even outside the domain of function, and those I would expect to change quickly too. Those are even somewhat more benign than the function because we're not putting as much stress on the system as a whole. But I'm afraid if you test things that are too aggressive and you don't see a change, you'll be missing what you actually need.